Hello, everybody. My name is Billy Strew, and I am the Planning and Engagement Coordinator with Texas Homeless Network. And I just want to take some time with you today to discuss a new resource that we have recently made available called the Mainstream Benefits Repository. This is a resource we're really excited about and want to help walk you through just some quick items with this. So the agenda for this presentation is to give you a quick overview of mainstream benefits and then to dig into the repository, giving you the purpose of this document as well as how to use it. And then just some quick next steps of some things you can do if you want to be more involved with this document and its the evolution that it could go through. So, quick overview of mainstream benefits. Now, the purpose of this presentation is not to dig into the weeds of all the definitions of mainstream benefits. That will be a space for another presentation that hopefully can come in the future. But for this presentation, just to briefly mention that it is publicly funded services, programs, and entitlements for low-income households that address basic needs. Now, these services, programs, and entitlements include, but are not limited to, financial assistance, such as temporary assistance for needy families, housing services, such as housing vouchers, child care and education services, such as Workforce Solutions child care assistance, or being aware of who your McKinney-Vento homeless liaison is within your school district. Employment and workforce services, such as other programs through Workforce Solutions, as well as health and behavioral health services like Medicaid, Medicare, or the local mental health authority. Now, there's all kinds of other categories that could fall under mainstream benefits, but this just kind of gives a quick overview. Now, why are mainstream benefits important? They may be a primary source of income and health services for households. It can be a predictable income that can bolster stability, financial stability, as well as housing stability. Mainstream benefits assist households to obtain and retain housing. They are support for rent and food and other basic needs, as well as a resource to increase independence and well-being. Now, mainstream benefits are extremely important for society. Now, I want to briefly mention that there are all kinds of barriers that communities and individuals and households face to try to access mainstream benefits. So systemic barriers can include, especially in rural areas, geographic and transportation demands, a negative atmosphere in trying to apply for mainstream benefits, as well as potential stigma that people could feel, the complex and lengthy application process, documentation requirements, and just the complexity of the entire process. But then also the personal barriers that people face are the lack of transportation to apply or follow up, loss of essential documents for whatever reasons that might have happened, limited social networks, complications proving eligibility. There are all kinds of barriers that individuals and households and communities can face to access these benefits. This repository, while we hope it can help address some of these barriers, is not meant to do the work that is so necessary at the community and the agency level. Communities and agencies must work together with a strategy and approach to ensure that low-income households can find ways to access the benefits that they need or that they are entitled to be sure that they can move towards stability, financial stability, and housing stability, and just well-being. So let's dig into the mainstream benefits repository. Now, this image on the left here is this idea of there just being all kinds of points everywhere and just finding a space to connect all the dots. Sometimes accessing mainstream benefits can feel like getting a jigsaw puzzle and dumping out the pieces and just not knowing any idea of how to put pieces together. The repository is hoping to be a space where those pieces are somewhat put together in a way to help get people moving in a general right direction. It's a resource for not just programs, but also for households and individuals, just for the general public to utilize. It is a living document that we hope to continually modify and update and monitor and keep it as useful and comprehensive as possible in real time. And it's also meant to be a roadmap, not the destination. It, this repository cannot substitute the need sometimes to be able to have a human being available to help assist with filling out and going through application process for SSDI or SSI or other mainstream benefits. It just cannot be a substitute for that level of assistance. But it can hopefully be a roadmap to help someone begin moving in the right direction. So I'm going to take a moment to look at the repository. It's broken down into 5 main columns. And so I'm going to pull this over. Every time you open up the repository, you will have this pop-up window that comes up that says this document is not an exhaustive list of available mainstream benefits. It's monitored and updated periodically. Please take time to review eligibility requirements before attempting to access any listed benefits. And for suggested updates to this document, please contact TXBOSCOC at thn.org. Now, we'll kind of touch each of these items in this pop-up window as we go along through the rest of the presentation. But it's broken down into 5 primary columns. You have benefit column, and this benefit column is broken down specifically into different categories, which we will discuss. And under each category, you will find the actual individual benefits that you can look into that may be available for you. Column C is the link for more info, which we'll discuss in a moment. Column D is how to access benefits. Column E is source. And column F is description. So let's get into each of these columns. So the benefit column, column AB. This is giving you what we have right now of the existing categories that we have broken down for the current iteration of this document. And this includes benefits navigation, health, food, financial, mental health, substance use, employment, safety, veterans, aging adults, utility assistance, housing, legal aid, childcare, and education. Now, there's probably a million ways that categories for mainstream benefits can be broken down and organized, but this is what we have at this point that can hopefully be useful for providers and the general public to be able to utilize and navigate this document. And as I mentioned, underneath each of the categories, you will find the individual benefits that may be available to you or to your client. So column C is the link for more info. The purpose of the link that's provided for each benefit under this column is to assist with further research regarding eligibility information. For example, income limits, age limits, family size, residency status, and all the other potential elements that a benefit might be looking at to determine eligibility. THN strongly advises, and you saw that in the pop-up window that comes up every time you open up the repository, it strongly advises that further research is done before any attempt to access benefits. Because as I mentioned, this document is not meant to be the destination, but just the roadmap. So be sure to utilize that link and find out the details to see how you may fit within eligibility before you actually attempt to access the benefit. Column D, how to access benefits. This column provides brief instructions to begin the process of accessing benefits. And so very brief. So examples might be a link that leads you straight to the application. It might be a link that leads you to the instructions for how to apply if it's not just an application portal online. It might be a phone number or an appropriate contact to call. And for example, sometimes it might provide a phone number. Sometimes it might just be contact your local food bank or your local mental health authority. Or it could be an in-person contact required, like apply at the clinic sites. And so just pay attention to that brief description to hopefully be a good starting point to move forward towards trying to access that benefit. Column E is looking at the source of the benefit. So I'm going to break this down real quick. There's 4 different options that you might see: national, state, regional, and local. For providers, this might be really beneficial to kind of help know what you're navigating, but also just for the general public. Our hope for this column is that you can see if if you do not have assistance from a provider or case manager or someone to help you walk through an application process, and you're needing to contact directly whoever the organization or agency that might be providing that benefit, this hopefully gives you an idea of who you might be trying to reach out to. So, national. This is funding or resource administered directly by a federal agency. So if it is a national benefit, if you're needing to reach out to the organization directly providing that benefit, you're probably going to be calling an agency of the federal government. State, very similar. Funding or resource administered directly by the state of Texas. Regional is funding or resource administered by a public entity serving a geography smaller than the entire state, but bigger than a county. So an example of this would be the local mental health authority of your region, or could be the local education agency of your region. And so it's bigger than a county, but smaller than the entire state level of benefits. And then local would be a funding or resource administered by city or county government entities. Column F is a description. It's a brief description given for the mainstream benefit. The intention of this description is to give a general idea of who the benefit might be best for or its general purpose. It does not go into detail regarding specific eligibility requirements. This is why THN strongly advises that anyone attempting to utilize this document does further research into the eligibility requirements and if that individual or household might meet those requirements before attempting to access any listed benefits. So what are the next steps? So you'll see here, you will be able to find on the website a PDF of these slides, but you'll also be able to find the direct link of the repository. But in this presentation, you can see a link there on this slide. Also, please feel free to share this document with others. This is not a document that is just internal. It is not just for agencies and providers, but it is for the general public of the Texas Balanced State Continuum of Care. And then also, we want this document to continue to become as comprehensive and useful for everyone in real time on a regular basis. And so please, because we're going to have benefits that will need to be updated sometimes. There might be benefits that we're not aware of yet that have not been listed on this document, or there might be benefits that haven't been discontinued and don't need to be on this document anymore. So please send feedback anytime if there's anything that you notice that or want to suggest that we can use to modify this document and make it even more useful and comprehensive. And you can send that feedback anytime to txboscoc@thn.org. So really appreciate your time today. Thank you for listening to this presentation. We hope that this repository will be very useful for the continuum of care and for you. Please reach out to txboscoc@thn.org if you ever have any questions or feedback. Thank you.